I'm Chirwa from Malawi. I'm an economist by training. I currently work for the Ministry of Health in the planning department. About 58% of total health expenditure is being financed by external partners. So that is good, but also it comes with its own challenges to the sector. These resources that we're talking about from the external partners is highly fragmented. So at the moment, I can say that we've got over 227 implementing partners. They are all over Malawi. As a ministry, it's hard for us to coordinate. It's hard for us to know what activities they're implementing on our behalf. And we also noted that there are times that they will go into a district to implement without the knowledge of the councils, the authorities in the districts. So they've been implementing activities not in line with our priorities as a ministry and as a sector as a whole. As a ministry on our own, we're not able to guide them as to what exactly were our priorities because we had so many documents, so many strategies on the ground. So what we did with technical support from Clinton Health Initiative was to make sure that we consolidate what we had on the ground. So we had the health sector strategic plan number 2, but also the policies that are being drafted, the plans that are being drafted by the district councils themselves. And in terms of sexual and reproductive health, we had some strategies within the Department of Sexual and Reproductive Health that we had developed. So we took hold of all the documentation, all strategies to make sure that we consolidate them into one document. So it's been a good process, but we have learned through the process that it's good to do joint planning between ourselves, the ministry, and also our partners. With the plan that we developed, we are calling it the Health Sector Strategic Plan Implementation Plan. So we're able to engage at bilateral level our partners. Now going forward, we want to make sure that within the Health Sector Strategic Plan, we integrate all programs. All strategies should be in the sector strategy document, and that is what is going to be a Bible for the sector. So we have one plan that we implement ourselves and the partners, one report, one review. What do I want other countries, my fellow planners in the ministers of health, to take from our experience? I want them to appreciate the importance of joint planning, but also to know as planners, as government, as ministers of health, we need to take leadership, we need to take ownership, we need to guide the process. So in our case, sitting down, developing the plan, now it is us as a ministry, as a sector, leading, taking leadership, and also guiding the partners where we think we need to prioritize. That's the major lesson that I want my fellow planners to learn from our experience.